The pandemic changed the daily routines and bladder habits of a lot of people. People are now working from home and have access to a bathroom right next door. So it's tempting for many of us to want to use the bathroom more often, which makes it kind of difficult to ignore that first signal of bladder filling, which we normally probably would if we were out and about in our daily work environment. You might find interesting, which I did when I read the statistics from the Aeroflow COVID survey, is the decrease in physical activity and exercising less. Now, you might be thinking, well, what does that have to do with my bladder symptoms? Well, it actually has a lot to do with your bladder symptoms. In fact, physical inactivity and exercising less leads to an overall body deconditioning, which does negatively impact your bladder. During stressful situations and persisting anxiety and worry, the brain also gets amplified and magnifies the signals that come from our bladder, for example. So if you're experiencing bothersome bladder symptoms like urinary frequency and urgency, incontinence, or bladder pain, here are just a few treatment ideas that you might want to consider. First, consult your local pelvic health therapist to assess your pelvic floor muscles and to learn specific bladder urge suppression control techniques to help your brain, your bladder, and your pelvic floor muscles better communicate with each other and dampen that very annoying bladder urge. Next, you may want to consider bladder training, which includes using a log to track your bladder habits. Then you can observe and reflect on what bladder habits might actually be exacerbating your urinary symptoms. In addition to bladder training using a log, it also includes pelvic-specific exercises and coordinated training techniques to help communicate better with your bladder and your brain. An example of this might be doing a couple of quick Kegels or pelvic floor contractions that communicate with the bladder and say, hey, relax, take a chill pill, calm down. Other techniques that maybe include bladder training include focused breathing, and also a timed voiding schedule so that your bladder can learn to hold in a relaxed way more urine over time than frequently going, let's say, every 10, 15, 20, or 30 minutes. On average, normal voiding times are anywhere from 2 to 4 hours. So we would want to train the bladder to be able to tolerate that particular capacity or timed voiding intervals in between your trips to the bathroom.